Ünal Hoca sesiniz kapalı. Ekran paylaşımı ama ses yok.
Okay.
Okay, we are listening to you. You may continue with your presentation.
Okay, sorry. Okay, sorry again. Hello there, participants. I will hurry. I will try to give information about corrective trimming and therapeutic showing in navicular syndrome treatment in horses. Navicular syndrome is a clinical manifestations of a number of different disease processes associated with the navicular bone, the fibrocartilage of its flexor surface, the palmar part of the distal interphalangeal joint, the deep digital flexor tendon, the navicular bursa, the navicular suspensor ligaments, and the distal impar ligaments. It's the most common cause of lameness in the forelimbs that occurs intermittently in horses between the ages of 4 and 15 years. Although the hind limbs can be affected, it's predominantly considered a problem of the forelimbs. It's estimated that the syndrome is responsible for 1/3 of all chronic forelimb lameness in horses in North America. Male quarter horses and thoroughbreds, particularly geldings, seem at greatest risk, whereas the syndrome is rarely diagnosed in ponies or Arabian horses. This syndrome has been shown to have a hereditary predisposition, which is perhaps related to conformation. Factors such as faulty conformation, hoof imbalance, improper or irregular showing, and exercise on hard surface are believed to predispose and to aggravate the condition. Lameness is insidious in onset and intermittent initially. In radiological diagnosis, radiographs are taken in torso-palmar, 60 degrees, lateromedial, and palmaro-proximal palmaro-distal position. In these radiographs, radiological changes in the synovial fossa located at the distal border of the navicular bone are taken into consideration. Treatment of early cases of navicular syndrome with minimal radiographic changes can be rewarding. In chronic cases with radiographic change, it's hoped that the progression of the syndrome will be prevented. Treatment usually involves variable periods of rest, corrective trimming and showing, drugs to improve blood flow, non-steroid anti-inflammatory drugs, corticosteroids, hematological agents such as isoxaparin hydrochloride, pentoxifylline, propantofilin, metramperon, and recently drugs specific for the treatment of arthritis such as sodium hyaluronate nutraceutical. Rest is important to allow time for soft tissue inflammation to subside, to allow the horse to acclimate the corrective trimming and chewing, and to allow the navicular bone to begin the remodeling process. Most would agree that corrective trimming and chewing is the basis for treatment for navicular syndrome. Many horses respond favorably to this without need for further medical or surgical therapy. The aims of trimming and chewing are to restore normal food balance, correct food problems such as shearing of the quarters and heels, underrun heels, and heel bulb contraction, reduce the biomechanical forces on the navicular region, and protect the injured region. These applications should be done from the onset of clinical symptom. The correct recovery point is determined on the toe, and corrective trimming is performed according to the recovery point. Breakover has been defined as the most dorsal location of the solar aspect of the hoof capsule that contacts the ground during weight bearing, and its last part of the hoof capsule to leave the ground in the caudal phase of stride. Therapeutic showing is applied to ensure flexibility and facilitate breakover during stride. In cases in which the horse still has broken backward foot pastern axis or has a tendency to land too fast, the heel may have to be elevated when a shoe is applied. Elevating the heel can establish a normal foot pastern axis and a heel first contact at a walk. For this purpose, rolled toe with raised heel shoes, egg bar shoes, white webbed seated out shoes, equine digit support system shoes, and natural balance shoes are used. The shoe should be applied to enhance breakover. Rolling, rockering, and squaring the toe of the shoe increases breakover and reduces the pressure on the deep digital flexor tendon. If a natural balance shoe is used, the distance from the frog apex to the inside border of the shoe should be 3 mm to 6 mm for small shoe, 6 mm to 9 mm for medium shoe, and 9 mm to 12 mm for large shoes. A long sloping pastern is one characterized by a normal or subnormal angulation of the forefoot with a pastern that is too long for the length of the limb. When there is a broken angle between hoof and pastern axis, the foot axis is steeper than the pastern axis. Broken back, unfortunately, axis resulting in excess pressure on